Blood clots, medically termed thrombi, form when the blood coagulates or clumps together. This clotting process is crucial for stopping bleeding when a blood vessel gets injured or cut. However, clots can also spontaneously develop inside veins or arteries without a wound. These clots restrict proper blood flow and oxygen transport, which can be extremely dangerous. Clots that form deep within the veins, usually in the legs or pelvis, are called deep vein thrombosis, DVT. A DVT may restrict blood return from the legs, causing pain, swelling, and discoloration. Pieces of the clot can also break off and travel through the heart to the lungs. These clot fragments cause a blockage called pulmonary embolism, PE, which can be fatal. Certain risk factors like smoking, obesity, immobility, cancer, and genetic factors can increase the chances of developing problematic clots. Treatment typically involves anticoagulant medications to prevent further clotting and dissolve existing clots. However, several key vitamins and supplements may provide added benefits when used appropriately under medical supervision. Vitamins help promote healthy circulation, make blood less sticky, reduce platelet aggregation, support vessel elasticity, and enhance your body's natural fibrinolytic mechanisms for breaking down clots. By improving blood flow and stability, vitamins can hasten clot dissolution as adjuncts to standard anticoagulation therapy. This video will explore the top 6 vitamins with the strongest clinical research supporting their safe use for blood clot treatment. We will look at their mechanisms of action, optimal therapeutic dosages, food sources, and effective supplementation strategies. 1. Vitamin E. Vitamin E refers to a group of 8 naturally occurring fat-soluble compounds, with alpha-tocopherol being the most bioavailable and biologically active form. This vital antioxidant vitamin protects cell membranes from oxidative damage and dangerous inflammation. Vitamin E has specific antithrombotic properties. It helps prevent blood clots by limiting platelet aggregation and adhesion. Platelets are specialized cell fragments in your blood that cluster together at the site of an injury, forming a clot to stop bleeding. However, abnormal platelet aggregation can cause obstructive clotting within intact blood vessels. By reducing platelet clumping, vitamin E enables smoother blood flow and decreases the risk of harmful thrombosis. Several major clinical studies have found that vitamin E supplementation significantly reduces the risk of blood clot formation and associated complications like pulmonary embolism. A large meta-analysis of over 10 controlled trials concluded that vitamin E lowered the incidence of venous thromboembolism, blood clot forms in a vein, by 21% compared to placebo. Researchers believe the ideal supplementary dosage for clot prevention is 100 to 800 international units, IU, of natural vitamin E daily. While the RDA is just 22 IU daily, studies confirm that vitamin E is safe and well tolerated at higher doses of up to 1,200 IU in healthy adults. Excellent dietary sources of vitamin E include nuts, seeds, vegetable oils, dark leafy greens, broccoli, avocado, salmon, trout, and shellfish. Daily ingestion of 100 to 400 IU mixed natural tocopherol capsules is recommended. Vitamin E synergizes with vitamin C. Combining the two may help dissolve clots faster than alone. Always consult your doctor before using vitamin E supplements, especially when paired with blood thinners. While generally safe at the suggested dosages, vitamin E may enhance the anticoagulant effects of medications like warfarin. Your doctor can help determine the right balance and timing of supplements to avoid bleeding risks. 2. Vitamin C. Also called ascorbic acid, vitamin C is a water-soluble nutrient that is a potent antioxidant and enzyme cofactor throughout the body. It supports immune function, the formation of collagen and connective tissues, iron absorption, and wound healing. Vitamin C reduces inflammatory pathways that can harm blood vessels and raise clot risk by protecting lipids from oxidizing damage. This versatile vitamin also helps keep arteries relaxed and flexible for healthy circulation. Numerous studies confirm that inadequate vitamin C intake is linked to increased thrombotic complications, while supplementation may help safely dissolve clots. Research also indicates intravenous vitamin C may help dissolve dangerous clots when used alongside anticoagulant medication like heparin. Oral vitamin C supplements provide similar benefits. The RDA for vitamin C is just 75 to 90 milligrams daily to prevent acute deficiency. However, experts recommend much higher supplemental doses of 500 to 1,000 milligrams daily to target blood clotting issues specifically. Excellent dietary sources include citrus fruits, bell peppers, broccoli, kiwi fruit, strawberries, tomatoes, and leafy greens. Vitamin C has low toxicity as excess is excreted readily in urine. However, massive doses may cause indigestion or diarrhea. For best absorption, take vitamin C supplements with meals and start with low doses, gradually increasing under medical guidance. 3. Vitamin K. Also known as phylloquinone, vitamin K supports activating key clotting factors in your liver. This enables your blood to form well-regulated clots to seal injuries and prevent excess bleeding. However, vitamin K also prevents overly extensive clotting within undamaged vessels. It helps maintain the body's natural homeostatic balance between bleeding and clotting. Vitamin K further supports vessel elasticity by preventing calcium deposition and activating inflammatory pathways. Observational data shows that low vitamin K intake is associated with arterial stiffness, blood vessel calcification, and increased risk of thrombosis and embolism. One major Japanese study found that adequate dietary vitamin K intake reduced the risk of pulmonary embolism by 40% in women. Another study linked low vitamin K to a 50% higher chance of developing venous thrombosis. The current RDA for vitamin K is 90 to 120 micrograms daily for adults. The best food sources are leafy greens like kale, spinach, collard, broccoli, eggs, meat, dairy products, and soybeans. Supplements containing vitamin K1, phylloquinone, in doses of 100 to 200 micrograms daily are also recommended to support anticoagulant status. Unlike vitamins E and C, which provide general antithrombotic effects, vitamin K is more targeted in optimizing coagulation function. Your doctor can help determine if vitamin K supplementation is appropriate for your condition. 4. B vitamins. 8 distinct B vitamins play key roles in red blood cell metabolism, energy production, neurological function, hormone activity, and cardiovascular health. 2 B family members crucial for normal blood coagulation are vitamins B6 and B9. These water-soluble nutrients help regulate blood levels of homocysteine, a byproduct amino acid that causes oxidative damage at elevated concentrations. Research shows that high homocysteine strongly correlates with abnormal blood clotting and a greater risk of thrombosis and embolism. B vitamins like B6 and B9 allow your body to metabolize homocysteine and safely maintain lower, healthier blood levels. Multiple clinical studies confirm that B vitamin supplementation significantly lowers homocysteine. This, in turn, reduces cardiovascular disease risk by up to 30%. Excellent dietary sources of B vitamins include poultry, fatty fish, chickpeas, spinach, broccoli, avocado, nuts, seeds, citrus fruits, whole grains, and nutritional yeast. For optimizing blood clot risk specifically, experts recommend daily supplemental doses of 100 to 200 milligrams of B6 and 800 to 1,000 micrograms of folic acid. While generally safe at moderate doses, very high intakes of certain B vitamins may be problematic for some individuals. Clinical guidance is always advised when adding supplemental vitamins to your health regimen. 5. Vitamin D. Sometimes called the sunshine vitamin, vitamin D is produced in your skin during exposure to UVB sunlight. It can also be obtained preformed from certain animal foods. Whether synthesized inside the body or ingested in the diet, vitamin D undergoes metabolism by the liver and kidneys to become biologically active. In its active form, vitamin D is a powerful steroid hormone precursor, playing a major role in regulating calcium absorption and bone health. However, emerging research suggests vitamin D supports cardiovascular function and healthy blood coagulation. Some observational studies have found that low blood levels of vitamin D correlate with an increased risk of potentially deadly venous thromboembolism, VTEL. Proposed mechanisms include regulating the body's immune inflammatory responses that influence clotting and direct effects on the elasticity of vascular smooth muscle tissue. Experts recommend maintaining an optimal 25-hydroxy vitamin D blood level between 30 to 50 nanograms per milliliter year-round. This cannot always be achieved with diet alone. Along with safe sunshine exposure in appropriate seasons, supplementation is often required. The current RDA for vitamin D is 600 to 800 IU daily, but many experts suggest this is inadequate for a large portion of the population. Those concerned with blood clot risk may need 1,000 to 4,000 IU of vitamin D daily during winter months or year-round. Ideal dosing should be determined clinically based on regular blood level monitoring. 6. Vitamin A. Vitamin A is a group of fat-soluble compounds called retinoids. This vitamin exists in two primary forms. Preformed vitamin A found in animal foods like liver, egg yolks, dairy products, and oily fish. Provitamin A carotenoids like beta-carotene are found in plant foods like carrots, sweet potatoes, spinach, and red peppers. Once obtained from the diet, vitamin A supports vision, immune function, cellular communication, embryo development, and red blood cell production. It also aids mineral absorption and has antioxidant properties. Some research indicates that inadequate vitamin A intake is associated with an increased risk of certain thrombotic events, while supplementation may help normalize clotting. The mechanisms are not fully proven, but vitamin A appears to help regulate the accumulation and adhesion of platelets. The RDA for vitamin A is 900 micrograms of retinol activity equivalents, RAE, per day for adult men and 700 micrograms RAE for women. While toxic in very high amounts, studies suggest daily supplements ranging from 5,000 to 10,000 IU vitamin A may support antithrombotic effects under medical guidance. Multivitamin supplements and cod liver oil also provide preformed vitamin A. Carotenoid plant forms like beta-carotene are not proven to impact clotting and should not exceed RDA levels. In summary, various vitamins offer beneficial mechanisms that help dissolve blood clots and lower the risk of recurrence when used appropriately alongside standard medical care. Optimal therapeutic dosages and combinations should always be determined clinically based on your condition, risk factors, and prescription medication regimen. Vitamins are not substitutes for anticoagulants or lifestyle changes. However, they can improve the effectiveness of your comprehensive blood clot treatment plan when used sensibly under medical supervision. Along with targeted vitamin supplementation, make positive lifestyle modifications like quitting smoking, losing excess weight, exercising regularly, and hydrating sufficiently. Reduce alcohol, limit prolonged sitting, and avoid constrictive clothing that can impair healthy circulation. Listen to your body and seek prompt medical care if you develop potential clot symptoms like leg swelling, pain, redness, or shortness of breath. Thank you for watching the video. Please like, share, and comment on the video. Please subscribe to our channel and click the notification bell.